because two gangsters, they came in and they shot the patient twice.
They shot him in the hospital.
Shot them in the clinic, yeah.
Do people ever come in with like really weird or interesting injuries?
Yeah, we had a guy who walked in with his knife in his neck.
It was through his neck.
It was in the back of his neck.
Oh my
in.
word.
So Russia has more skinheads than the rest of the world. That's when I did my research back then.
And what is a skinhead?
Skinheads are a neo-Nazi group that attack people who are not white. I tried to run towards the street. Somehow, some of them tripped me and they were only kicking my head. I didn't think of anything else except how I can move, because I knew if I don't move, I'll probably be dead.
As a doctor, have you ever faced a situation like that where you're like,
Of course.
I do not want to treat this person?
I'm not sure if they're supposed to tell us, but like this person was f***ing a 12 years old girl, for example. Now you have to treat that patient. It's very difficult, but you took an oath.
What's up, everyone, and welcome to the Wide Awake podcast. My name is Joshua Rubin, and I am your host.
Are you ready?
Today, I have an awesome guest. His name is Dr. Sia, and he is a medical doctor and social media influencer with 3 million followers.
Let's just reverse things. I think
Yeah.
you're doing great. You're doing amazing. I don't think anybody in the country doing what you are doing, and
Thank
all
you.
your podcasts are very like attention grabbing and interesting. And I see you doing some documentaries, which
Yeah.
I saw a few this morning and I was very impressed. So regarding my journey, I think I started a lot earlier than you. Maybe that's why I'm a little bit ahead. I started my journey in 2020 when the pandemic started. And I was, as everybody else, escaped to TikTok. I was making content with my daughter just as an escape from the stresses of the daily job. And everybody was asking me, what do I do for COVID? Do I do this? Do I take that? What are the symptoms? I was like, instead of answering 20 WhatsApp messages, I can just make one video and be like, guys, watch it.
Yeah.
And that's when my video started getting attention, going viral. And that's how it started. Within 6 months, WHO approached me to tell me, well done. Started collaborating. I was in British Medical Journal for my work, Huffington Post, Good Morning America. And
Now you're here.
that's how it, yeah, exactly.
So before we get into all of that stuff, I mean, I just want to know a little bit about you.
Sure.
Where do you come from and how did you become a doctor?
Okay, so I am Persian. I was born and grew up in Kuwait, in the Middle East. I went to Moscow to study medicine. And after that, I came to South Africa to do research at UCT. And after that, I'm doing clinical work for
And
the past 10 years, yeah.
How come you decided to become a doctor?
I know everybody will say like you can help people in many different ways, but I wanted to make an impact in people's quality of life. And I think the most rewarding thing in medicine is when you save someone's life. That's you work differently the next day. You are a superhero when you bring someone basically from dead to be alive. That's the best feeling that you have in medicine.
It's like something I've never really been able to understand. You know, doctors seem like these like indestructible human beings that like you guys work insane hours under extreme pressure. And like you say, you literally are the barrier between life and death sometimes. What is it like when you lose a patient? How do you deal with that?
I think we're not indestructible. That's why we have the rate of depression in doctors is twice as high as other professions. And probably most of my colleagues are either seeing psychologists or being to psychiatrists because we all probably burn out badly. We develop resilience with time. So when you lose a patient, it's never easy. But when you're a junior, it affects you really badly. And the more you practice, the more you experience, you become more resilient. You will never get used to it because we are human at the end of the day. But you learn when there's an emergency how to stop being emotional and just think with your brain. So if you're outside and some emergency happens, people will probably scream and run around. We as doctors will be like, you do this, you go call an ambulance. Start helping me do CPR. So that's what we learn with experience.
It's how to cope under extreme pressure.
Yes.
And do you remember the first, I know we're kind of jumping straight in here, but
Yeah.
do you remember the first life that you lost? One of your patients?
I remember the first one that got to me. It was a 6 years old girl that was in a car accident. She came to the clinic and she was in a stable-ish. She was sitting, talking with her mom, and then suddenly collapsed. It got to me because my daughter was 6 years old, and seeing her, suddenly his his heart stopped beating, stopped breathing, trying to resuscitate her. I'll never forget that moment. Yeah.
And I mean, one of the reasons that I wanted you on the podcast was because on New Year's Eve, I saw something that shocked me. It was, you posted on New Year's Eve, you were working, right, at the hospital. And you work in, what area do you work in?
I work in a primary healthcare in a township.
In a township, yeah. And you on New Year's Eve, you posted a story on your Instagram feed. And you said that, well, you didn't say anything. You just posted it, basically the waiting room outside. And this is why the people were in the waiting room on New Year's, is because stab wounds. I mean, I'll just read the list. It says blunt assault, stab, blunt assault, stab, blunt assault, stab, stab, blunt assault, stab. I mean, that's insane. What is New Year's like as a doctor?
This is not only New Year. This is basically every month end. New Year obviously is worse because people drink alcohol, they get drunk, and they argue and they stab each other. It's every month end where we know they get paid, they go get drunk and stab each other. It's very difficult for people this side of Cape Town to realize that just 15 minutes drive from town, you have that. When you have 40 stab patients in a weekend. New Year's are known to be a bloodbath. Like whenever I go to do the morning rounds or work, it's blood everywhere. Patients waiting to go to Hotiskier. There's almost everybody is stabbed or shot. That's why when during COVID the government banned alcohol. I know most people was like, what alcohol has to do with this whole thing? That's the same reason, because when they stopped alcohol, there was no alcohol to drink, to get drunk, to stab each other, to shoot each other, because then ICUs were open. Because when you drunk drive, hit someone, they come in, you have to intubate, you have to refer them to Hotiskier. That's how their ICUs are filled on month-end weekends, New Year's, public holidays. So yeah, that's one reason why I'm still working in a primary healthcare, because you get opportunities like this to save life. I always tell people, like, I don't see myself working in private because you don't get to see such patients. Or in private, if you hurt your finger, you're going to go the next morning or same day to the private. But in rural places, people don't go same time, or they don't have transport or money to go, and they come after 3 months when they have a huge growth or a cancer, which is very sad, but you get to see those cases, you get to be able to make a change in someone's life, and that's the rewarding experience that I crave.
You get to make a real difference and help people that really need it.
Exactly.
Right at the beginning of the podcast, you mentioned that you worked in Russia.
Yeah.
How did you end up, working in Russia?
So I studied medicine in Russia. I was the first child of my family. So my parents weren't very experienced in applying to universities and stuff. And when I finished school, I was in the top 50 in the country. So we finished school at June and we applied, and I was kind of confident they're going to take me. Me also not knowing, well, how's the process? You need to apply like 6 months or a year in advance. So suddenly by, I think it was July, August, one of my family friends told my dad, there's a university that is recognized by WHO, is one of the best it is the best university in the Soviet Union, ex-Soviet Union and Russia. And the first 3 years in English. And I was like, why not? Let's go. That's how I went to Moscow. And Moscow is very cold. So I studied medicine for 6 years. And I don't know if I told you about skinhead story.
The skinhead story. You mentioned it when we were having coffee, but would you mind telling it again?
So Russia has more skinheads than the rest of the world. That's when I did my research back then.
And what is a skinhead?
Skinheads are a neo-Nazi group that attack people who are not white. And in Russia, I'm black. I remember people telling my
There's like no black people in Russia.
There are black people.
Very
but
few, though.
I think anybody who is not white Russian, it's going to be at risk of being attacked. So on Hitler's birthday, which is 20th of April, a day before and a day after, the foreigners don't go to university because all skinheads from all over Russia, they come to Moscow to attack foreigners. And luckily, I've been safe throughout my 6 years, and I was doing a year of just practical for myself. And that's when I was in the wrong time, wrong place, attacked by skinheads. I've had broken bone, seizure over my head. Thankfully.
Can you set the scene? Like,
yeah, of course.
Tell me about the day. You woke up, you got out of bed, you were going where?
Okay, so I went out for dinner, and I was on my way back home, and I could see, because skinheads, they have the heads are shaved, and they're generally in groups, and I could see them coming on my side of the road, and I thought if I turn around and run, they're probably all gonna follow me, and I feel like I also had like pride, like I'm brave. Maybe it was a stupid thing to think back then in that situation. So I put my head down and I went past them. But I think one of them saw me and I got punched. I tried to run towards the street. There was like a 20 meters of snow. And I'm a sprinter, but somehow some of them tripped me and they were only kicking my head with these boots. I didn't think of anything else except how I can move, because I knew if I don't move, I'll probably be dead. So I was crawling towards the street, and as soon as I reached the street, they all left me. I walked back home, called an ambulance, waited 2-3 hours. Ambulance didn't come. My friend took me to hospital. I was there for like 12 days. But I was fully awake, alert. They put me in a neurosurgery department with people who were having neurosurgical conditions. Like the guy next to me was speaking in numbers. The guy across me has half of his head, half of his brain was, cut off or had operated on. So I was testing myself every night. 2 + 2 is 4. 4 by 4 is 16.
You're trying to make sure that you didn't have brain damage.
I'm still fine. So, yeah, and then I got discharged and life continued.
When it comes to, as a doctor, right? What is it like to be a doctor and be at the mercy of another doctor in a way, Because you're so used to having people's lives in your hands. How does it feel to have your life in someone else's hand?
Doctors are bad patients. So it's a difficult question, but sometimes you just have to trust. Especially that you are a doctor, but you're also not a specialist in that field. So that's maybe one more reason to okay, he is the specialist, so I trust that person. You must trust your doctor, and you shouldn't, as doctor, we always like to treat our own illnesses. And like my daughter, whenever she was sick, I would treat her, and then after a while I'd be like, you know what, you need to go to hospital.
Go to a real doctor.
So after
that knows, that specializes.
Exactly, a pediatrician.
Yeah.
So I learned from the beginning, you should let go. You should let go and just go to the specialist that knows better than you in those even simplest of things. Yeah.
So you were in a ward with people that had severe trauma or illnesses.
Yeah.
You mentioned someone was only speaking in numbers. How does something like that happen? What part of the brain gets damaged? Do you know?
No. At that stage, I just finished medicine, so I wasn't really aware. And since then, I haven't gone back to investigate all the cases that I saw back then. So I haven't. There were severe cases. I was on a top hospital in Moscow. I wouldn't be able to answer that question.
And so you were in hospital for 12 days after this attack, right? Do you have any lasting effects from this attack still to this day?
Not that I can notice. Yeah.
So you look good. You look pretty.
Yeah, I probably looked better back then.
We all looked better back then.
Yes, probably, yeah. So, I don't think...
And was that a big reason for you to move to South Africa? or to
I
get
actually
moved somewhere else?
You'd be surprised. So I think I have a strong mentality. So even after that, after I got discharged, I went back to work and they looked at my face and they're like, dude, you need to go home and rest another few weeks because I'm sure my eyes was bruised and the stitches on my head. After that, I still tried to go back to work. Going through the same paths, it kind of like bring like some PTSD, like you watch behind your back to make sure there's nothing happening. And you'd be surprised, I didn't tell any of my family members until I got discharged. Because I was like, what is the point of telling them, which they are living on the other side of the world and they cannot do anything about it? So why stress them? I'm doing okay. So once I got discharged, after like a month, I told them, and then they really wanted me to come back. So I put myself in their shoe and I was like, any parent would have been like, you know what, this is not worth it, come back. So I went back in like with the decision that I'm going to visit them and I'm coming back. I didn't take anything. I went with an empty suitcase because I was determined to come back and finish my practicals, which they were like not needed already. Once I got home, I was like, it's very safe, very calming. I was like, that's not worth it. I went back to Russia. I took all my stuff and went back home. Yeah.
And then?
And then I applied from Venezuela to Japan, everywhere. There was a website where you have all the medical schools around the world. I wrote to all of them to come for research or to specialize or anything. University of Cape Town was one of the few that said, you can come, you can do your research, we'll pay your tuition fees, we'll pay you scholarship. And I always wanted to work somewhere that is beautiful. So I don't want to go somewhere that is best university in a desert. You know, I wanted to be somewhere where I can enjoy life and or enjoy quality of education. And that's why I came here.
And has it lived up to what you thought it would be?
Yeah.
You love it in Cape Town?
I don't want to go into politics, but Cape Town is a very beautiful place. There is crime, which is very sad. And there's corruption, which is also very sad. But everywhere you go, there's positive and negatives. So you just choose where you want to live with what positivities and what negatives. So I think Cape Town has been, it is an amazing place. And whoever disputes that, I tell them, go live abroad. You're going to come back and you're going to appreciate Cape Town.
Exactly. So, I mean, what are the biggest differences that you noticed working in a hospital in Cape Town, in a township, versus Russia? What were the biggest differences that you noticed straight away? In terms of maybe like people coming in, what the common thread between illnesses and injuries? Like I'm sure in Russia, you probably didn't see as much of the blunt force trauma and stab wounds like you see in the townships here.
Definitely, yeah.
So using that as an example, like was there anything that you really noticed was very different between Russia and South Africa in terms of medical infrastructure and working in a hospital?
I think most hospitals look the same. Education is kind of the same everywhere. I think you just said it. The amount of trauma we see in South Africa, I don't think people see it in developed countries. Like I don't remember seeing a single assault in my time. Maybe I was in a different kind of clinics because even in Cape Town, if you go maybe to Constantia Clinic, I'm not sure if there's a clinic there or Greenpoint, you're going to see less trauma than you working in a township. Areas like Kailicha, Nyanga, Guguleto, those places, even doctors are at risk. Doctors get attempted hijacked, assaulted. You can just Google, and there's instances where like gunmen come to the clinic to finish the job. So I was speaking to one of my colleagues who worked in Kailicha before. He said there was a night where they had a gang person was shot and they're trying to
So there was a gang fight?
Yes, outside. So one of them came inside and they were trying to resuscitate that person. And suddenly there were noise. Everybody was scared, running around because two gangsters from the opposition one, they came in and they shot the patient twice.
They shot him in the hospital?
Shot him in the clinic, yeah. So this is not a new thing. I don't think such instances are like people on like, I don't think newspapers are aware of such issues because I feel like they're trying to suppress such news, not to make people scared. Hanover Park clinic was a 24-hour clinic, but they made it. They closed the night shift, so there's a week, and like at night it's closed because gangs kept coming in, robbing people, jumping on fences. So,
were you ever there when a robbery took place? Because I mean, it seems to be quite common. You were just telling me about a story where one of your colleagues was robbed at gunpoint this morning.
Yeah. Attempted hijack this morning. I was at work when I got a call from one of my colleagues saying to come to this room, and I ran to the room because I could hear her voice was like shaking. And one of my colleagues won an attempted rape on a Friday, midday, in her office.
One of the
at work
patients.
One of the patients tried to rape one of my colleagues. So when I got to the room, her scrubs were torn, her pants was a little bit torn, she was on the floor, room was messed up. Yeah, thankfully she was not physically harmed, but I was emotionally traumatized. The whole clinic is traumatized. Some years before that, our porter was stabbed to death outside of the gate.
Your porter?
Yeah.
What's a porter again?
Porter is like the person who
transport
patients around or stuff like this. So I heard that there was an argument between him and an escort, and the escort waited outside with a knife, and as soon as he stepped outside, he got stabbed. So it is not very safe. And it is, I don't know. We can talk about this for a very long time.
Something that I'm actually quite interested in is because there's a lot of people that need to be seen by doctors, right?
Yeah.
Especially in townships and places like the Cape Flats. And a lot of your patients seem to be people that are coming in with gunshots and stab wounds or like domestic violence abuse cases. And then you get people that like maybe have cancer, like stage 4 cancer or something, or have AIDS and really need treatment, right? How do you prioritize where you spend your time? So like say the hospital's full and a gang member comes in with a gunshot wound and someone comes in with a severe illness, maybe like an aneurysm or something, right? Who do you prioritize?
Okay, very good question. So all hospitals, they have a triage system. Triage basically means to sort out. So all patients, well, unless you are a red, which is like so red is an emergency, orange is very urgent, yellow is urgent, green is non-urgent. Green is basically you have flu, you have rash, and your vitals are stable, you become green. So we see patient according to the triage color. Chest pain is orange. Somebody who's unconscious, shot, obviously his blood pressure going to be down, his pulse going to be up. That's red. That they go straight to the resuscitation room. And that's where you start seeing that person. On weekends, like the one you saw, for example.
The New Year's Eve.
The New Year's Eve or month ends, Saturday nights, you can get few of the red ones at the same time. So there are usually 2-3 doctors on the shift. And you and the nurses have to resuscitate 1, 2, 3. And you have to prioritize who has the better. So if you are like only 2 doctors and they're like 4, you have to decide who has the best chance of living, and you try to resuscitate that person. Obviously, you're going to try, the nurse is going to try with the one, you try with the other one. Once you stabilize this one, you go to the other one. But you have to know who has the better chance. And
so it's whoever has the better chance of living.
Yeah,
so it doesn't matter why they came in. It's just whoever has the better chance of living.
That's when you have, let's say, there's a massacre happening. Like I think a few years ago, there was a Boko Haram massacre just the road across the clinic. And there was 2 doctors and I think 3 patients came. I think 1 survived, 2 died. But so when you have more emergencies like this and you are like 1 or 2, then you have to decide. Because you cannot intubate 3 patients. You cannot put 3 patients on oxygen. You don't have that many oxygen even. So you have to obviously do your best because it's not only you. The nurses also can help you. But when it's crisis like this, then you have to, even when like a crisis happens, there's a guidelines. When a plane crashes or whatever, you go there and you're like few people, then whoever has a better chance, that's where they help.
You know, I mean, sorry, I know this is such a bit of a random topic, but even like in America, right, where they have such a big problem with mass shootings and stuff, the ethics behind all of it is so interesting because if you think about it, like say like a mass shooter, right, comes into the hospital after shooting up, say, a school, and the mass shooter was injured or wounded by the police. Like the ethics behind, do you treat him? You know what I mean? Like as a doctor, have you ever faced a situation like that where you're like, I do not want to treat this person, or you know what I mean? It's a bit of a weird way to say it.
Exactly.
Yeah. I don't want to say it in a bad way, but you know what I mean.
No. Police brings patients. So in rural areas, because people don't trust the police and the judging system, whatever you call it, they do community assault. So if they catch you,
Township justice,
yeah. If you rape someone or stole something, the community beats you up. They don't kill the person, but they make sure bones are broken. He's like on the verge of death. And then suddenly police bring this patient and I'm not sure if they're supposed to tell us, but like this person was raping a 12-year-old girl, for example. Now you have to treat that patient. It's very difficult, but you took an oath and we do treat. Because in rural places, most of these people were shot. I'm not saying all of them, or stabbed. They come in with their 26, 27, 28, gun, tattoos. So
you see the affiliation straight away. Yeah. I mean, I had a gang member on here, the last podcast I did, or one of the recent ones I did, and he was telling me about a shootout that he had with the police where he was shot 5 times.
Oh yeah, I saw that.
I mean, but he also shot people in that same incident, and it's like you don't really think like someone has to treat this guy, you know, a killer. Really, you have to treat, and it's an interesting decision because I don't think there's many other lines of work where you would have to face a decision like, do I save a murderer? Do I not? You know?
I know. Like yesterday, we were supposed to talk, and I told you I got stuck in an emergency. Was a member of 26 gang that was shot in the abdomen. So as a senior doctor on the clinic, I was on my way, like I was leaving, and then suddenly it came in. So I obviously rushed back, tried to help the trauma, resuscitate a little bit, do the things, stabilize, and then I left. So I think we do this because we have passion of saving lives, and we separate ourselves from being emotional. That's probably, I don't want to say makes it easier, but I guess makes it easier because emotionally we're not attached. We don't put ourselves in what he was trying to do. Or
you have to separate it.
You have to separate because if I think what he was doing before he got assaulted, then it's going to be very difficult for me to do my best and help him. So I've learned over the year to just separate my emotions completely and just focus on what I'm supposed to do. As I said, like junior doctors, it's very difficult for them to do similar things. And I always tell them, you do your best, whatever happens. Because sometimes you bring someone to life, resuscitate, give all the blood thinners we have, do your best, but we don't have equipment. An ambulance sometimes takes like 6 hours, 10 hours, sometimes half an hour, but it can, like I have had cases where I was very proud of our team. This person was basically dead, brought him back to life. He was speaking. But ambulance took, I think, so many hours that we used all our bloods. He was bleeding internally. At the clinic level, we cannot do any kind of operation. We don't have anesthesia. So person passed away. And you need to learn to not beat yourself up because you did your best with whatever you had. And that's what I try to teach the junior doctors, that you did your part, you did your best. There was nothing else you could do. So, because they go home, they beat themselves up, they cry, they suffer, they become depressed. And to do medicine, you need to learn. You cannot go on having emotion to your patients.
What happens when you make a mistake? How does that affect you? And because like a friend of mine, right? And maybe I'll change some details because it's
of course.
It's a sad story, but basically, a friend of mine's dad was given the wrong medicine and a way too high a dosage, right, for a mental illness, and ended up committing suicide, right? How does that like affect the way you work? Because obviously you want to do the best job you can do, but at the same time, you're still a human that makes mistakes.
I think I don't know any doctor who hasn't done a mistake. Not necessarily mistake that killed the person's life, but I think in Western Cape we are more privileged to have access to specialists. If you do something wrong, you can always call like Grooteskier Hospital, Tigerberg, and speak to a specialist who can give you advice on
Get a second opinion.
second opinion. I have colleagues who worked in middle of nowhere in Eastern Cape, for example, where there is even to transfer the patient, that's like another 6 hours of like few hours of drive or ambulance. So making mistakes is part of the whole learning thing. And my job as a senior doctor is always to counsel, educate, and obviously if there's negligence, like you didn't, mistakes happen, but if you did mistake because you were negligent, you didn't check this, you didn't do that, then they're gonna be reprimanded.
Pretty harsh on you,
disciplinary processes and stuff.
And I mean, you were mentioning as well, like this, obviously, it's a very stressful job. And I think it's the highest percentage of drug abuse. Like doctors have one of the highest percentages of drug abuse than any other job because they have such easy access to it and it's such a stressful job that they turn. Is that correct or no?
I'm not sure about drug abuse. I know what you're saying because especially if you do anesthesia, there's like all the drugs in front of you. So it shouldn't be difficult to, there are processes, but I haven't heard of that. I know we are one of the highest in depression. Suicide is more than other careers, for example. So it is very stressful. Yeah, it is. I saw a meme where basically said, I don't know if I can use that word. I screw my life to save yours, which is true because when you do night shifts, you increase risk of your chronic illnesses, mental health.
Oh no, I can't imagine.
Increased risk of depression, death. Basically, everything goes up. So you doing 30-hour shifts, 24. I have done 24-hour shifts. Where at my 23rd hour, I had to do a cesarean section.
You had to do a what?
Cesarean section.
Oh my
But that's before I worked we don't do that in clinic. I worked in a hospital before. So that's how it is. And I'm sure it's the same in other countries. So it is, you basically
sacrificing
myself to save others. Yeah. Yeah.
Because I mean, you working night shifts, it's like your whole clock gets thrown off, man. It's not like it's very bad for you. As someone who stays up late nights, I don't feel good the next day a lot of the time. And to like imagine having a scalpel in my hand while feeling like that, I would not know what to do with it. But I mean, what is do people ever come in with like really weird or interesting injuries?
Yeah, we had a guy who walked in with his knife in his neck. I don't know if I still have the picture. I'm sure I have a picture somewhere. There's a kitchen knife. Half of his knife was at the back of his head, and he walked to the clinic, and he wanted us to take it out. And I was like, no, but he's taking that. Nobody touching that knife.
It was through his neck.
It was in the back of his neck.
Oh my word.
So he was stable. I assume that neck wasn't touching a nerve or a blood vessels. We spoke to Grooteskier Hospital because we're not going to touch it. It must be in an operating theater. He was taken that side and he was sorted. Another incident, one of my night shifts when I was working, a guy came and said I was shot in the mouth. I was like, dude, you can just sit down. I'll come to you because you can still walk around and come talk to me and stuff. I finished with my patient. I went back to him. I was like, open your mouth. His tongue was a little bit swollen. So I took the tongue depressor and I put my light and I looked at his throat and there was a hole in the back of his throat. So I was like, okay, maybe it's like a rubber bullet or something like this. I sent him for an x-ray. He came back from the x-ray. There was a bullet like millimeter from his vertebra, from his C-spine. I guess we only see the miracles because the other ones don't make it to come to the hospital. So I've seen few similar cases where the bullet is like millimeters away.
Yeah.
So I was.
And does anyone ever come in with like weird stuff? Like, you like.
Tell me what is weird. I've seen it all.
Yeah, like did you ever watch Jackass? Yeah. Like, the guys, one of the guys, I think it was, I forgot his name, but he put a toy car up his ass. It might have been Steve-O.
My weirdest case was something was stuck up the vagina and wasn't coming out. And probably that's the weirdest,
What was it?
was a spray cap.
A spray cap.
Yeah. I think the person was using the whole spray as...
The bottle and the cap popped off.
And then the whole spray as a way to masturbate. I'm sure if I don't know if I can say that word in the podcast.
Yeah.
And then I think the cap got stuck inside, yeah.
Jeez.
But this is not a weird thing. I mean, I've seen
That's not that bad,
brains out and yeah, I've seen it all.
You've seen it all,
I've seen
yeah.
it all, yeah.
One of the things that I was talking to you about last night was about this surgeon, right? And I think medical advances have changed the world.
Yeah.
And the way that we live our lives. You know, we're living longer now. You go for a surgery, you just go to sleep, you know. You wake up like nothing's ever happened.
Was never like this. I mean, it wasn't always like this.
But one of the things that really blew my mind was this video that I sent you. And I've just got some information here. It was about a surgeon called Robert Liston, right? And Robert Liston studied medicine at the University of Edinburgh in 1808 at the age of just 14 years old, right? And this guy was like known to be they called him the fastest knife in the West because he was extremely fast at doing surgeries, right? So Robert Liston was a Scottish surgeon. Liston was noted for his speed and his skill in an era prior to anesthetics, when speed made a difference in terms of pain and survival, you know, because before anesthetics, like if you had to do an amputation, if you take someone's leg off, right, they're going to feel every moment of it.
Has to be fast.
They're awake. And if you take too long, they're going to either bleed out or they'll die of shock. So this guy, Robert Liston, basically was known for these extremely fast surgeries where he would do these amputations. And these days, we know all about sanitation and we know all about like hygiene and we have all the new medical advances, right? But back in the day, they didn't know about any of this stuff. So what he would do is he would have like a crowd of people watching him do these surgeries, right? Because I think it was more of it was like a spectator sport back in the day. It was like, will they live? Will they die? Like, what's going to happen, you know?
Gladiator.
So the spectators, I'm sure, were mainly medical students and stuff watching and observing to learn. But basically, the way these operations would happen is these people would come, be put onto the operating table, and then Robert Liston would amputate, right? And back in the day, because they didn't know much about hygiene and sanitation, like one of the things that the doctors had was aprons full of blood, because it was a sign that the doctor was a good surgeon if his apron was full of blood, because that means many people were using him. So they would have these aprons and the blood would be like congealed and dried and crusty. And like he would be operating on someone with like an open wound with all of these germs on him, with like people screaming in the background. And like one of the things he was the most famous for was Robert Liston became the only surgeon in known history to have a 300% mortality rate from a single operation.
I saw that.
Yeah, he was doing a surgery and an amputation. And basically what happened was Liston was so focused on the speed of his cuts that he took his assistant's fingers off with one clean cut. And then when he swung the blade again, he hit someone else. And the person on the operating table died. So he literally killed 3 people in one operation. Which sounds like unheard of. You can look this up. Fact checkers, do your work. I mean, that's so wild.
It's crazy. I was watching it last night, and my wife and daughter in the background, they're like, what are you watching? I'm like, no, this is like from a few hundred years ago. But medicine is in an infancy. Antibiotics were discovered like what, 60 years ago?
I have no idea.
I think
not long ago. I'm sure,
exactly, not long ago. So we are at our infancy, and we have come a long way, but we still very at the beginning of
You
medicine.
think so, really?
Yeah, of course. Of course, we still have a lot to go. I'm sure at some point in the future, most of the illnesses will be treated with like natural treatments. But at this stage, we don't have enough knowledge to know if this herb works or not. I know people uses it, and I always tell the patients, don't use your herbal medication because they can interfere with your, like let's say HIV medication, for example, because there's not enough studies. I'm sure at some point in the future they will be used, but at this stage, best is to listen to your doctor's advice. In Township, there are many patients who go to St. Gomez They pay big amount of monies. I've seen few of them on Instagram where they charge tens of thousands.
The sangomas.
Yes.
Can you explain what a sangoma is?
I'm not the best. I think
It's like a traditional. It's a traditional spiritual healer. I think.
Yes, traditional spiritual
in
healer.
Africa.
Yes, and the patient usually
Or in South Africa.
in South Africa, and they have lots of patients that generally start there, and like we have patients who have like epilepsy, and they're having seizures for like years, and they come to us, and I'm like, but why are you coming now after many years? Because you can have like side effects, chronic, like a long-term side effects from like not treating it. And they were like, no, we're treating it by sangoma, and the sangoma, it didn't work, so now we're coming here.
And is it mainly people in the townships that go to sangomas?
Yeah, I would say so, yeah.
Because I've been looking into sangomas. It's very interesting, traditional healing and that kind of thing. Do you think it has any like basis or merit? Like, do you think it works at all?
I
don't think so. I'm sure there's like parts of it that work, because I think medicine as it is today was based on traditional healing, right? Surely, because before we knew anything about it, like that's how it started. Was
I'm sure we all grew up.
We smacked these rocks together over a cut, and then like the dust, like.
I mean, or when you grow up, I'm sure my mom would be like, eat this herb or this flower helps you with tummy and stuff. I'm sure it's like chamomile.
We've all had it in a different way.
We've all had it.
Yeah.
But to treat like diabetes or cancer, or we have a traditional healer who comes to the clinic for his own treatment. So I'm like, I've never had a conversation with him because his English is very weak, and I always have a nurse to translate. But I would love to sit with him one day, and I'm like, how do you do this?
I've wanted to have a traditional healer on for a while.
You want to have?
I really want to have one.
I will speak to him.
Well, someone that speaks English, because I'm so useless with other languages.
Traditional healers.
Yeah.
There are other people. When I go to work, I see on the wall all these posters that you can call to. People can increase your penis size.
Yes, we were talking about this earlier.
Yes.
So this is something that I've seen for years. Is the fact that like, and I'm sure a lot of people have seen this as well, especially around South Africa. I'm sure it's all over the world.
It's all over the world.
But there's these signs that say like, you can get like a penis enlargement, or find lost lover, or what are the other ones? I don't know what the other ones are. Like abortions. And it's like these people. I've never met any of them, right? But there's signs all over Cape Town, and I've seen them in other parts of South Africa as well. And it's basically just got those things, like you can get an abortion, you can get a penis enlargement, you can get a find your lost lover or dead lover. And basically you call the number and they help you out, apparently, right? So you've had an experience with these people, haven't you?
So yeah, I always drive and I see it stuck, this poster on the wall. So one day I took a picture, went to work. Yeah, one of my colleagues, we give them a call to see, because as a doctor, and especially when I do sexual health on my social media, I know there is no way to increase size of your penis. There is no oil, no cream.
Nothing.
The only way is a surgery where they cut one ligament, but it has side effects. You have only one penis, so rather like not play around. So I know these things. And I give them a call and I ask, I want to increase size of my penis, and he's like, yeah, what size do you want? I'm like, this size. Like, yeah, we can do it. This much cost. I'm like, if I want it bigger, then he's like, this much. You pay more. I was like, okay. And then how can I find my lost lover? He's like, depends on how much you pay and how many days we'll find it for you. And I'm like, I am sure there are people who are desperate who falls for these things, especially penis size.
I remember looking at it when I was younger. I was like 10 years old and I used to see these and I was like, maybe it'll work.
Maybe. Because I feel like all men, you watch porn and then you think that is how it's supposed to be. That is what a woman would want. That's what's going to give best sex. And you look at yours and it's like 13, 14, 12, 15 centimeter, which are all normal.
Yeah.
They're all normal. So... And then if I tell you there's a cream that can make you look like that, you would pay for it. But it's all scams.
It's all scams. And defining lost lovers. Did you talk about that?
Yeah, I talked about it. I think.
What did they say? How did they find them?
Oh no, I don't think I went that deep in the chat. Know. Yeah, because they could hear my voice that I'm not very serious about finding my lost lovers. But I think the more I paid, the faster would I found my lover.
Cool. So I mean, just moving on. the reason I found you, obviously, is because you have a very big presence on social media, right? You told me briefly like why you wanted to start social media, but just tell me again, like what is the journey, what is the goal, and what is the reason that you started posting on social media?
So initially it was as an escape, but then once I started educating people, it was more to raise awareness and educate and do my part of helping people being more educated and empowered. And I started by raising awareness on HIV, COVID-19. Then I started busting myths.
Busting myths.
Busting myths.
Breasting myths.
What is that? Busting myths. And then it was a medical myths. And that was my famous videos. And then one of the myths I busted was period myths.
Period, yeah.
And one of them was about, I added some sexual health in them. And that video got 30 million views. And I realized from the comments that people are not educated on their sexual health. And that is when I decided I'm taking the responsibility of doing sex education and empowering people with their sexual and reproductive health. Because I feel, not only I feel, it is actually sex education is a human right. You guys can Google it. And sex education is proven to make you take better sexual health decisions and maybe even do sex at a later stage. In South Africa, I saw an article like last week, South Africa has 90,000 teenage pregnancies every year. There are different reasons, but I feel like one of the main reasons is just lack of sex education. People until today, they think the pull-out method basically means you're having sex and you ejaculate outside of the vagina.
Yeah.
There is zero chance of pregnancy.
Because there's still pre-cumming.
There's pre-cum and the pre-cum has sperms.
Yeah.
I think efficacy of pull-out method is like 70-something%. So there's like 20%.
It's literally only 70%.
Yes, 70, 80%.
So there's a 30% chance that you're going to get pregnant.
Yes, exactly. So people don't know this, especially like teenagers.
Yeah.
The other thing is that always drives me crazy is that the morning after pills. Morning after pills work, but not if you have already ovulated, because they work by preventing or delaying ovulation. So if you already ovulated and you had sex, unprotected sex, and then you take the morning after pill, it's not going to work. Plus, if you're overweight, above certain BMI, the efficacy going to be less. If it's taken after a certain amount of days or hours, efficacy going to be less. And I don't think schools are teaching us these things.
I think, it's funny because like, I think some schools do, but I think it's maybe like I went to a pretty good school, right?
Okay.
And like they obviously taught us there.
Okay.
Like no one really cares though. It's so funny because it's a shame because it really is helpful information. But when you're like, it's so hard to teach like a group of grade 7s and 8s like about sex stuff,
It's true.
So, I mean, the girls were listening, the guys were just doing whatever. But I think now, especially with what you're doing, you're just making it. I mean, you can find it online as well.
Of course.
But the way you do it, you put it into these short videos, bite sizes, very easy to watch, and that they reach so many people. And it's very hard once you know something to ignore it, right?
It is.
So it's like if I didn't know that the pull-out method was not that effective, right? I might keep doing the pull-out method. But now that I know that it's not very effective, I'll definitely use a condom.
Yeah.
And I'm just using that as an example. I use condoms always. But I mean, so one of the big things you do is like medical misinformation and sexual facts, right?
Yeah.
So I've got a few here. Just to end off, I wanted to ask you a few, right? So the first one is I can get HIV from being around people who are HIV positive.
That is obviously untrue. HIV has a huge stigma in our country. We have patients who...
1 in 5 people have HIV in South Africa, apparently.
Wow. I know we are one of the top 3 countries in the world. And HIV, the stigma is so high that some people, they leave the clinics around them and they walk so far to come to ours because they don't want to be seen. But I'm going to make a statement, but I'm sure many other health workers will agree. HIV, it is far more easier to manage than diabetes, hypertension, asthma, any other condition, because all the other conditions you have to do diet, you have to exercise, you have to take tablets, take injections, morning, night. With HIV, it's only one tablet that you can take for the rest of your life. You're going to be fine.
That's amazing.
That's like the advancement that we came. I mean, like from HIV means death sentence.
It was a death sentence, yeah.
Now HIV, if you are HIV positive and on treatment, you have the same life expectancy as normal people.
That's unbelievable.
It's unbelievable. So yeah, HIV that's going to be transmitted through kissing, through touching, through sharing utensils, through hugging.
Is it mainly just sex, like unprotected
blood.
sex, right?
Blood to blood.
So like semen would do it, and like vaginal fluids would do it.
Yes.
And like obviously blood to blood, right?
Yes. And then, but we have, so if you have sex with someone and the condom breaks and you don't know if the other person is positive, you can come to the hospital or clinic and we're going to give you PEP, which is
instantly, hey? It's like the morning after pill kind of thing for AIDS or for HIV.
But you take it for a month. It's called post-exposure prophylaxis. So within 72 hours, the earlier you come, the better. And you take that for a month and it's going to stop reduce your risk.
There's also medication that can prevent it now,
Yes,
right?
PrEP.
So it's like if your husband or wife has it, it's the same medication. So you just take that all the time, or?
It's a very similar, but just different tablet. It's called PrEP, pre-exposure. And the other one is PEP, post-exposure. So pre-exposure, if you are in a relationship with somebody who's HIV positive, and you want to be extra safe, because once you're HIV positive and you're taking a treatment and your viral load is undetectable, there is zero chance of giving it to other person. But you just want to be extra safe. You can take the PrEP tablets. There is certain amount of time that you need to take it for it to be fully effective. So if you are going to be receiving, like if you're going to be the one receiving or giving it, I think there's like a certain amount of time that you need to take it before you're 100% or
before you're safe to do so.
Before you're safe to do it. So yeah.
It's funny because you mentioned like there's obviously a big stigma, right, with it. I've actually heard, because I know there's obviously a stigma with a lot of people, but there was someone that I've spoken to that's in my life that I know very well and is a lady, right, that has kids. And they said to me that, like I said, you must be very careful, right? Because a lot of people sleep around, and like I know people in my life that have died from AIDS, and I said just be super careful. You know what I mean? Because the culture, it's like a different thing where a lot of the time, like wives stay at home, and like the guys, especially in South Africa, like go and sleep around.
True.
And it's not obviously always like that, but I just basically said to her, I just said, be careful. You don't want to obviously get it. And she said to me that it's just a disease. She said she said, if I get it, I get it. It doesn't matter.
I know so I'm in no way promoting unprotected sex, because I cannot take my multivitamin. Well, I'm not for multivitamins, different chat. But like, let's say if I want to take omega-3s, it is very difficult to take it every day. You forget days, you get tired. So, and that's the reason why many HIV positive patients, they go to a level to become AIDS. AIDS is like the advanced HIV.
Yeah.
It's because
they don't take their medicine.
They don't take their medication. And I have proper chat with them. And I'm telling like, listen, this is the last straw, because you are now like your CD4 count is very low. One more mess up, you're gonna risk your life. And they are just tired of taking. It's just like, you think it's just take it every day and I'll be fine, but to commit to it is also very difficult.
Very difficult, yeah.
So yeah.
And then the second one is, this is like such a kid's one, but like masturbation makes you blind.
Oh, I did the masturbation myth video. I think
when I was younger, it's like the teachers and parents would always go, you know, if you masturbate, you're going to go blind.
I think my masturbation videos also went viral, like 20 plus
videos
million.
of you masturbating.
Sorry?
Videos of you masturbating went viral.
Those ones not going to go viral, but me debunking the myths on
I didn't know you could post that on TikTok.
On debunking?
No, on masturbation.
Yeah, I'm sure there are other platforms you can do it.
So yeah, masturbation makes you blind.
So masturbation, there is so much like misinformation about it, from decreasing your sperm number, reducing your testosterone, There's a no fab movement, like no
fat movements.
Yes, I think the only benefit of not masturbating is the discipline that you're gonna develop. That's the only. There is no health benefits from not masturbating, or if you masturbate. I mean, there was this small study. Let's just not go into it. The small studies, people who masturbated or reached orgasm 21 days in a month, they reduced their risk of prostate cancer. It's a very small study, but some benefit. There must be bigger ones. So there are benefits to it, but not going to make you blind. No hairy palms. Not going to make you bald. Not going to make you bald. Not going to shrink your penis.
Yeah.
It's all myths.
Okay. And then the next one is all woman orgasm.
It is very sad because I've seen many stats that only third of the women orgasm via sex, via penetration, and others need clitoral stimulation. So there's a condition called anorgasmia where you cannot orgasm. And I always encourage such people because they come into my comments and like, you need to see a sexologist or people who are specialized or a psychologist because there could be mental issue, could be trauma from the past, or it could be you doing something wrong. So the treatment for anorgasmia is to know your body, to masturbate. So that's how you know what turns you on, what not. Yeah.
And just because like I want to help guys out here, right? Obviously this show has a lot of guys watching, right?
Yeah.
Like 70, 80% is guys.
Great. I have some tips for guys.
Right.
Yeah.
So I want you to tell me, because we've been talking about like orgasm and stuff, right? I don't know. You say only 30% of women orgasm. Can you explain where the clitoris is? I'm asking for a friend.
I need clitoris is the one easy to find. The G spot is the one guys cannot find. So clitoris,
Which is more important, the G spot or the clitoris to making
both
orgasm?
are very important.
So you have to stimulate both.
So clitoris is the easier one to find, easier one to.
That's on the outside, eh?
Is on the outside and is on top of. So most people think the vagina is the outside part. So the outside part is called vulva. Vagina is the canal. Okay. So if you look at the vulva, there is the vaginal entrance, and above it is the urethra, where the pee comes from, and above that, below the hood, is the clitoris.
Okay. And tips to last longer in bed?
Can I just so I feel like sex is also something that you need to learn, practice. I mean, practice alone without knowing what you're doing is not going to really help much. There are YouTube videos that can teach you how to use your fingers, what kind of sex to do, how to last longer. I had a podcast with a sex professor, and she told me this educational porn where
I've seen it. Like I was helping a friend.
People have sex and then they stop and they explain things to you. I'm not gonna lie. I've learned there's some guru guy on YouTube where it tells you tips. I mean, I didn't follow all his things, but like exactly when you do where to find the G spot, how to
basically if you want to know, there's information out there.
There's information out there, and you need to spend time and energy on those things because people they kill themselves about this penis size and they go pills, oil, whatever. Instead of spending that much energy on this thing, spend it on learning how to do oral, how to use your fingers.
That's exactly it. Like there is other ways.
I get all this, whatever you mentioned now, I get them on my DMs, and that's what gives me even more motivation to
share this information,
empower the people. You won't believe, I get questions like, I kissed a boy, my period is delayed. Am I pregnant? I don't laugh. I'm like, so how old are you? How old are you? They're like, I'm 13, 14, 15, 16 years old. And it's not one person. There's multiple times I've gotten this question. My partner, we're dry humping. My period is delayed. Am I pregnant? He used his fingers. Period is delayed. Am I pregnant? So it gives me more motivation and it's rewarding that I can empower these people, because once you're empowered about your sexual health, you'll be more confident, not only in bed, in your relationship. And relationship, I feel like it's like two wings. One wing is physical, one wing is like, I don't know, emotional or spiritual, you want to call it. And physical is also important. So to learn, to be empowered, to do better, it's gonna help your relationship also.
I would say the biggest thing that I learned, right? Because honestly, like if I tell you I was such an awkward kid when it came to like sexual encounters and stuff, and I think not more than normal.
Yeah.
But I just had like, I was scared when I was younger. But I think that the biggest thing that really helped me get over the fears was open communication with the girl or the partner that I was with. Because I had all these fears inside of me. And a lot of the time they have fears as well.
Course.
Often if you just say it to the girl or the person that your partner, they'll understand completely. And you'll find that the problem goes away because you've opened up about it.
That's how do you call it in English? Hit the nail on the whatever it's called.
Hit the nail on the head.
Yeah, exactly. Because I tell people, communicate. Even this faking orgasm story, it is basically you lying to your partner that you are doing great, having an orgasm, instead of telling him what can turn you on, what can help you reach orgasm. Communication. So as you said, communication. Once you communicate, I'm sure they also have their fears. They're also going to communicate because everybody have some insecurities in a way. And you may think my partner going to be turned off about, let's say, a scar I have here,
or me
for
being
example,
a virgin
or a stretch
or whatever,
mark or something. Yeah, exactly. When the other partner doesn't even care or see this thing. So communication, it is probably
Very
the main
key,
thing,
yeah.
the one of the main things in the relationship. Yeah.
Well, doctor, thank you so much for coming on today. Before we sign out, will you just tell the people where they can find you on social media and
So
where they can see your stuff?
drsia.sia on Instagram, TikTok, Facebook, YouTube. That's where they're going to find me.
Dr.Sia.
Yes.
Cool. Thank you so much for giving me your time and coming through today. It's been an absolute pleasure chatting to you.
Thank you for having me. It was a pleasure.
And I hope you guys enjoyed this episode of the Wide Awake podcast, and I'll see you all very soon. Cheers.